Today I'm going to be talking about a counterintuitive way of dealing with the scariest worries that you find yourself worrying about. Hi everyone. In this video I'm going to be talking about how to deal with type 2 worries, a counterintuitive way of managing worries about those scariest things, those most upsetting things that you find yourself worrying about. Worries about future catastrophic events that haven't happened and that may never happen, but you just can't stop worrying about them. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a replacement or substitute for advice from your doctor or mental health professional. So with those two things out of the way, let's start talking about managing type 2 worries. So this is a continuation of our series on worry management. We've talked about a lot so far. We've talked about the basic engine of worry. We've talked about intolerance of uncertainty, the fuel that drives this worry engine. We've talked about 5 common worry beliefs that can perpetuate excessive worry. We've talked about how ineffective problem solving can contribute to both worry and anxiety, and then flow back into making a person less efficient at solving problems. In the last video, I talked about type 2 worries, shifting our attention to type 2 worries, which are worries about future or potential problems. And I talked a little bit about how these type 2 worries are maintained by something we call cognitive avoidance. Because these worries tend to be so upsetting and so distressing, they tend to tap into our core fears and the things that we dread most. It's natural to want to deal with these worries by trying to push them out of your mind. Try not to think about them, try to distract yourself, try to get these worries out of your head whenever they come up. But as I talked about in the last video, trying not to think about something actually causes you to think about it even more. It's something we call the paradox of thought suppression. So if trying not to think about the type 2 worry is what's causing the worry to come up over and over and over again, the solution, the tip or the tool for managing these types of worries may seem very counterintuitive. And the idea is, rather than trying not to think about the worry, rather it's to think about the worry over and over and over and over and over again until you essentially drain the emotion out of the worry thought. So again, remember that worries they're just thoughts, they're predictions about the future. And with these type 2 worries, what can happen is you have this anxiety and this emotion connected with the worry and the worry thought. So every time the worry thought comes up, the anxiety comes up. And if you feel really anxious every time this thought comes up, it makes sense to want to try and get the thought out of your mind because the anxiety is really uncomfortable. So the way around this is by thinking about the worry again and again and again. The metaphor I like to use to explain this is to imagine that you're watching TV. And one day, there's this weird satellite glitch that happens. And whatever it is that you're watching on TV disappears. And what ends up happening is this really grotesque, horrible horror film comes on the TV. And it's really upsetting and it's really gross and distressing. And so you just turn off the TV. But the next time you turn on your TV, lo and behold, the same thing happens. The same movie interrupts what you're watching, and it gets really distressing for you, and you turn off the TV. You do it again, and it just keeps happening. Well, imagine what would happen and how you would feel if you watched if you allowed yourself to watch that horror movie all the way from the beginning to the end? Well, you'd probably find it really distressing. You'd probably find it really uncomfortable and really unpleasant. And you feel really distressed watching that movie. But then you force yourself to watch it a second time. Well, the second time you watch it, you may find it even more distressing and even more upsetting because you kind of know what to expect. And you kind of know the horrors that are awaiting. But then you force yourself to watch it a third time, and a fourth time, and a fifth time, and a sixth time. By the 100th time, you've watched the horror movie. By the 1,000th time, you've watched the horror movie. What do you think is going to happen to your emotional reaction to it? Well, you're probably going to be pretty bored. You're probably going to be like, oh yeah, guy jumps out of a shower with a big knife. Big deal. The movie hasn't changed one bit. What's changed is your emotional reaction to the movie. Essentially, it's drained any emotion out of the movie. And so it's no longer all that distressing. And so you're watching the same movie. It's the exact same movie that you saw the first time you saw it when it was really upsetting for you, but it's no longer upsetting. It's the same process with this idea of cognitive exposure. You essentially want to take these type 2 worries and think about them over and over and over again to their really horrible end, the most distressing parts of it that you don't let yourself think about. With these type 2 worries, what often happens with people is their mind will go to a certain point in the worry and then they say, okay, you know what, that's too much. I can't take it anymore. And they stop thinking about it. And so it's almost like one of those old-fashioned record players, and it just keeps skipping. So it plays the same part of the song and just keeps skipping over and over and over again. So it's not playing the song all the way through. And that's what happens with these type 2 worries. A person doesn't allow themselves to think about the type 2 worries all the way through to the horrible end that they imagine. But by doing this, and by doing this repeatedly, essentially what you're doing is you're giving the worries the airtime. So it's almost like these worries want their airtime. They want you to think about them. And so you give the worries their airtime and you think about them in concentrated ways until the emotion essentially drains from the worry. And if the emotion drains from the worry, it's not going to be so upsetting when it comes up. And if it's not so upsetting when it comes up, you're probably not going to try and push the thoughts out of your mind. So it's a bit of a strange concept to wrap your head around, but it works. And in fact, this is the exact same treatment approach that we use for people with post-traumatic stress disorder. The difference between post-traumatic stress disorder and this is that in post-traumatic stress disorder, the traumatic event has happened to the person. It's happened to the person in their past. Whereas in generalized anxiety disorder and excessive worry, the traumatic event is something that a person imagines happening in the future. But it's the same process to drain the emotion out of the thought. So how do you go about doing this cognitive exposure? How do you do it? Well, cognitive exposure is different than worrying about the worry. With cognitive exposure, the idea is you sit down and you write out a script, imagining your type 2 worry in all of the graphic, horrific, upsetting detail that you can imagine, all the way to the end, to those darkest parts that you don't even allow your mind to go to, that you don't let yourself go to. And you take your mind there. You write out this script detailing what you imagine happening. And I encourage a person to write out the script in the first person present tense. So like it's actually happening to them. Because what that can do is it puts you in the worry scene. It puts you in that scenario and allows you to sort of more closely imagine yourself in that situation. And so you write out this script. It should be anywhere from like 1 to 3 or 5 minutes long. It doesn't have to be any longer than that. But you want to include as much detail as possible, as much sensory detail, as much thought detail as you can. So I'll give you an example of a script. Now, this is a script for someone imagining that they're going to die of cancer. So the script may go something like this. I was diagnosed with my cancer a few weeks ago, and it has spread rapidly through my body. The cancer is my fault because I didn't take care of myself. I had an unhealthy lifestyle. I ate poorly. I spend too much time in the sun without sunscreen. So it's all my fault that this is happening to me. I've gone through a series of upsetting and painful procedures. The treatments have caused me to lose my hair. I've lost weight. I'm fatigued. I'm exhausted all the time. I'm now coughing up blood, and it makes me sick every time I see myself in the mirror. I know now that I'm on my deathbed. I can feel my life draining from me. This was all my fault. I did this to myself. And now here I am in this hospital bed, having just soiled myself, and I can smell how awful it smells. And I feel exhausted and weak. I can't even call out for help. I'm in this darkened hospital room, in this darkened ward, and I see only shadows in the background. I know my death is coming soon, and it's going to be a bleak emptiness that I'm going to face for eternity. So now, notice that may not be something that you worry about. But that type of script, it's descriptive enough that it's like this kick in the gut. It should make you uncomfortable. And so the idea is you write out this script about this really horrific type 2 worry, whatever your type 2 worry is, whatever the worry that you're struggling with is, you write out a script as detailed as possible. And once you have that script, the idea is to take 30, 45 minutes, an hour a day, and read that script over and over and over again. So you read the script all the way through, and I encourage people to make a note of how upsetting or distressing it was on a scale from 0 to 10, where 0 is not distressing at all, 10 is extremely distressing, extremely upsetting. So after every time you read the script, you make a rating from 0 to 10. Then immediately you read it again from 0 to 10, make a rating. And again, and again, at least 10 or 15 times in that 30 to 45 minutes to an hour chunk of time that you're setting aside to do this. You want to do this at a time when you're not going to be distracted. So turn off your cell phone, sort of get away so that people aren't going to be distracting you. Now, it's key to understand this is going to be very distressing. It's going to be very, very difficult to do. It's going to make you feel very uncomfortable. And so if you're feeling uncomfortable even at the thought of doing it, that's normal. This isn't something that anyone should look forward to doing. Because the whole idea is to bring up the emotion, to bring up the distress, and to learn to cope with it and to let it just go away on its own, like watching that horror movie over and over and over again. So you do these ratings, and what you should find is that within a session of doing this, so from the beginning where you start with a rating, the first time you read it may be a 9 out of 10 or a 10 out of 10, and then you read it over 15 times, what you should find is that at the end of that 15th time of reading it, your rating should be lower, right? The first time you do it, maybe your rating at the 15th time is a 5 or a 6 out of 10. And then you do it again the next day and the day after that. And I encourage people to do this for a week or two. And what they find is that over the course of that week or two, the ratings both within each session tend to decline, and between each session, they tend to decline. So after a couple of weeks of doing this, the distress at the 10th or 15th day that you've done this, those distress scores are a lot lower than they were in the first day. So this is, like I said, a very challenging exercise. This isn't something that you want to do with every worry because it takes a lot of time and it's quite distressing. So you want to use this on those worries that are particularly problematic, those worries that come up again and again that you're really struggling with, because this works. It's not pleasant, but it works. So I liken it a lot to that Buckley's cough syrup commercial. It tastes awful, but it works. That's kind of what this cognitive exposure is all about as well. It tastes awful, but it does work. So this is something to try if you notice yourself having type 2 worries that you're still struggling with, even if you've tried tolerating uncertainty, even if you've tried challenging those worry beliefs, and you're still finding yourself struggling with type 2 worries. Maybe you want to think about writing out one of these cognitive exposure scripts and going through and doing this cognitive exposure. It's not easy to do, it's very difficult to do, but it can be extremely worthwhile to drain the emotion out of that worry so you don't worry about it as much. So I know that's kind of a heavy topic to talk about, and it's sort of a very difficult skill and tool that I'm presenting. So I would love to hear your thoughts and ideas about this. So please leave me some comments down below. If you're interested in seeing more of my videos, please hit that subscribe button and that notification bell, and you'll be alerted whenever I post a new video. So that's all for today. Thank you for making it all the way to the end of this video, and I will see you in the next one.